our work unique is the detail in which we analyze someone's spine. We take very accurate computerized digital x-rays of the spine and measure the size and shape of your spine to 1/100th of a degree. That allows us to custom tailor an alignment. The computer calculates an alignment that tells us how to very gently and very accurately realign the body. Let me explain. This is your skull, and these are the top 3 bones in your neck. Believe it or not, you do actually have a hole in your head. This is, remember that 3 and the 12 zeros, 3 trillion? This is where all those messages are passing through. So if you were going to become a chiropractor tomorrow, and you wanted to correct nerve interference, would you work down at the bottom, or you want to work up here? You want to work up here. If you could work in the brain, we would get there, but we can't get that high. Now, if over the course of your life, this 1-ounce bone called the atlas, named the atlas because it holds, after the Greek god that holds up the world, it holds up your world, your head. If this little vertebrae, which only weighs 1 to 2 ounces, misaligns, ever so slightly, can you see how it can start to block and interfere with the messages coming from your brain to your body to your brain every second? Now, there's something called macro trauma, which is like Christopher Reeves falling off the horse, and what happened? The messages got stopped and he lost control of just his neck or his whole body. His whole body in an instant. And that's a severe example of nerve interference. And loss of what? Function, and loss of what? Health, and then loss of what? Life. Now, what if over the course of our life we have a misalignment in that same area, but to a lesser degree? How is that going to affect our neurophysiology and our body's ability to self-heal and self-regulate over time? It happens so slowly in most instances that we don't notice it from one moment to the next. We get 10 years down the road, 5 years down the road, we look back and we go, what is happening? I don't heal, I'm always sick, I got these problems. We work with the upper cervical spine because we want to be able to impact the neurophysiology. We don't just focus on neck pain and headaches because we work with the neck. That's like saying the doctor gives you a shot in the butt and he's a butt doctor. He puts the medicine in there, but it goes all over the body. We put the alignment into this region and it affects the entire body. Upper Cervical Care has been getting quite a lot of exposure over the past couple years. We were featured on Good Morning America because of a recent study that came out of the University of Chicago that showed that this type of work actually lowers blood pressure more effectively than high blood pressure, more effectively than 2-drug therapy. And NIH just gave Palmer College, a chiropractic school, lots and lots of money to study this because of that pilot study. And we've seen that clinically. And Montel Williams gets adjusted by an upper cervical doctor in Manhattan and had Upper Cervical Care on his show. He has multiple sclerosis, if you don't know. And we were on Channel 2 News New York just a few months ago. And the doctors featured Upper Cervical Care. So there is a momentum, a growing momentum of the public's knowledge about what it is that we do. Now, excuse me. Let's go back to Stephanie. Pat calls the office. She goes, "Can you help my daughter?" I said, I remember the conversation. It's clear as day. I said, I don't know whether or not I can help your daughter, but I know in one moment she was functioning just fine, and in another moment she lost function. And if she has nerve interference at the top of her spine and her atlas is out of alignment, I know beyond a shadow of a doubt that I can reduce that misalignment and then wait and watch and see what her body does. And Stephanie's healing did not occur like that, like turning on a light switch. She healed with time. It was a process. And what happened was, I remember she went back to school, and then she went back into the gym, and then she started tumbling. And then I remember the day she came into the office, and I think you were working, she said, "Dr. Larry, I did giants." Who knows what giants are? That's when you go all the way around the uneven bar. And so she recovered her health, and all I did, it's so simple in the happy birthday. She missed it. She was outside. You missed that joke, Lori. We'll let you slide. All we did was take some pressure off of Stephanie's central nervous system and allow her body to recover and recuperate. Now, as I had said before, it sounds so simple, the concept of healing and taking the pressure off of the nervous system. The procedure is far from simple. It is extremely complex. And we have two practice members here today that were gracious enough, as I said before, to share their experiences, which are two totally different experiences in our practice. The first gentleman that I'm going to call, his name is D. We've been taking care of him and his wife since probably 2007, long before your second child was here, right? We adjusted Sunny while she was pregnant. And now the whole family is under Wellness Chiropractic Care. And I'm going to bring D up to tell his experience. And let's give him a round of some support.
So they told me I only had an hour to tell my story. Hit the head or drink the head. Actually, I'm proud enough to be a business owner here in our wonderful state of New Jersey, and this is also the home of these two great doctors. And I'm kind of glad that I bought a Cadillac, because I really do feel like I'm on my way to wellness. We need to talk about that.
No, we didn't.
Well, really, let me qualify and start by saying that, qualify by showing you guys an example of how broken I once was, and I really was. I endured a couple car accidents within a short period of time. Once was by a drunk driver who left me hospitalized for a little bit. And so basically what happened and what I endured was, my body could only heal to a certain potential. And then that's when every doctor throws every pain medication they possibly can at you, and they call it pain management. I call it waste of life. But I was told that basically I'd have to live to endure some of these things. And it wasn't a very good experience, but I started to, it didn't stop me. I still went on to do some things, and eventually, when I realized that there's just got to be a better way, I started to keep my ears open for other things. And that started by realizing that I had these issues. I would go to the doctor and I would read some of these diagnostic charts, and I would read all 50 symptoms and say, wow, I've got like 40 of those. That's me. Does anybody do that? Every single poster I got that. And so, I started thinking to myself, that's just not okay. And one day I stopped all of the pain management to really figure out what it was that I was working with. And you know what, I dealt with a lot of discomfort. I dealt with, I don't know if anybody can relate, but literally at a young age, I wasn't about to pick up a shovel. I couldn't really go out and shovel the snow. Not that I would want to, but I literally couldn't. I knew that if I shoveled a couple strokes, something would get out of whack, and all of a sudden my lower back would bother me for about a week, or my neck would start to send complaints through my nervous system to a pretty uncomfortable point. And so what I started to do is I started seeking out other doctors and just trying whatever it was that I could, because I knew I wanted to do something different. And through my experience, again, I was able to get to a certain point, and then I kind of left myself with just a couple things, and even that wasn't okay with me. My major complaints were lower back pain, my neck, sometimes shooting pains going down my arms because of my neck, headaches because of my neck, and a lot of sleep disorder because of my neck and lower back pain. I think I graduated from every sleep study there is, including Yale, New Haven.